Hello friends, good morning all. I am Dr. Kodes. Welcome you all to my YouTube session. In this slide, I am going to deliver a lecture on subclinical ketosis, its importance and prevention. As all of you know, the disease ketosis, why it occurs, its clinical manifestations, its treatments, and the prevention as well as the control measures. So, in this slide, we are going to discuss the subclinical ketosis. Means the ketosis which does not manifest the clinical symptoms, but it present inside the animals. So let's discuss what is the subclinical ketosis. So this is prepared by me, Dr. Kulasan Deuri. I am a MBS scholar in gynecology and graduated from OUT, Bhubaneswar. So, so what is a subclinical ketosis? It is nothing but an excess amount of circulating ketone bodies without any clinical signs of ketosis. So, what are the ketone bodies? We have to first know the ketone bodies are nothing but the acetone, beta hydroxy butyrate, and the acetoacetic acid. So, these are the your ketone bodies. It is also known as acetonemia and manifested by hypoglycemia and ketonemia. So, this is acetonemia means acetone body concentration in the blood. It is known as acetonemia, and it is manifested by the hypoglycemia, that is decline decreased level of your blood glucose level, and ketonuria, that is your ketone bodies in urine. The circulating ketone body is most commonly used to diagnose SC beta hydroxybutyrate. So out of three ketone bodies present in the blood, so the beta hydroxybutyrate BHBA is the most important one to detect this subclinical ketosis. So what are the ketone bodies? I have already told the acetoacetate, the beta hydroxybutyrate, and the acetone are the ketone bodies. So you have to remember all these names. So in ruminants, the major dietary source for glucose, as you know, the propionate. Propionate supplies the main glucose, and which is the main source of energy to the animal, and it is obtained from the grain diet. So main energy source from amino acids, which is from the body sources also feed also. So during the long starvation and low dietary or low dry matter intake during the pregnancy, what happens when the animal is in dry state? The owner of the animal does not feed any going to feed any sufficient amount of feed or any qualitative amount of feed to the animal, as the animal is not giving any milk. So at that time it is under a long starvation. So this starvation leads to your burning of your animal fat, and that fat leads to production of the ketone bodies, and that ketone bodies circulates in the blood, and that condition leads to your ketosis condition. Is nothing but the hypoglycemic conditions. So body reserves fat undergoes the oxidation process, that is your burning process, to form these ketone bodies. So in this condition, insulin has a tremendous capacity to lower the blood glucose level in power of lipogenesis and lipolysis. So lipogenesis is nothing but a process to generate new fat, and the inhibit of lipolysis means there is breakdown of fat. So insulin has a tremendous effect to maintain the blood glucose level by playing a striking balance between the lipogenesis process as well as the lipolysis process. So, what are the factors behind this disease? Due to the imbalance between the inputs and outputs, uh, arises after post calving period. So, during the inputs means in dry conditions, the farmer does not give any adequate amount of feeds, and the outputs means there is after parturition, the animals are generally giving high amounts of milk and colostrum, and as you know, in colostrum there is more around 20 times more calcium than the normal milk, and this imbalance predisposes to these diseases. So inadequate nutrition in dry periods always leads to the ketosis either in clinical or in subclinical form. So subclinical ketosis cannot be detected by by physically, but there is a heavy loss to the farmer. So it got unnoticed. So what are the epidemiological features we see found in countries where intensive farming is practiced? So spring and winters season the disease prevalence is more, but nutritional management holds the key causes. So in 90% case of subclinical ketosis, fast lactation animals are more susceptible. So peak prevalence of the subclinical ketosis is 2 weeks of the post calving. It is around 14 to 21 days. So risk factor for the subclinical ketosis, prolonged previous intercalving intervals and prolonged dry periods, cows with twins, okay, displaced abomasal displacement either left or right, any septic conditions such as mastitis, metritis during your parturitions or after parturitions. So all these factors lead to this subclinical ketosis. So economic significance, as you see, there is loss of money as there is decline in the production level. So obviously there is cause a devastating effect and to the income to the farmer. So decreased milk yield, increased rate of delayed oestrus. So non-return to return to the estrus after parturition is generally 60 days. So within 60 days, if it is around 90 days, then there will be heavy loss to the farmer. So lower fast service conception rate means after parturition, if the animal does not get concept in either in first or second estrus, then there will be also heavy loss to the farmers. And in the case of the COD, cystic ovarian degenerations, so these are the economic significance of this disease. So monitoring subclinical ketosis with blood metabolites. So we have to detect and we have to analyze the ketone bodies in the blood. Then we can know and make them quantify so that we can know the levels of the ketone body in the blood as well as urine. So as we told, the beta hydroxybutyrate in the cows holds the most significant clinical features as well as the main diagnostic tool to detect the subclinical ketosis. So as you know, if the animal undergoing the subclinical ketosis, the value of the beta hydroxybutyrate get increased to a manifold. Once the liver NEFA means non-esterified fatty acids can be oxidized in completely carbon dioxide, partially oxidized to ketone or ester by triglycerides. So these are so this is nothing but the how the ketone bodies are produced from non-esterified fatty acid in the liver and how it circulates to the body. So it is nothing but the whole mechanism. I have prepared this slide. So analyzing the beta hydroxybutyrate in cow holds the most clinical significance. So this is one of the gold standard test for monitoring the subclinical ketosis in serum beta hydroxybutyrate due to the its stability in blood. So we cannot quantify this compound in the urine because it is highly unstable in the urine. So blood serum is the best source to diagnose. So a cutoff point of 1400 micromole per liter. So this is the standard. If it goes beyond that level, then this is a case of your subclinical ketosis. So we have to collect the blood within 12 to 14 days of the post calving. So this is so in this period the incidence of subclinical ketosis comparatively more compared to other periods. So most reliable and cost effective one. So you have to remember and can be used as a cow side test for subclinical ketosis. So monitoring subclinical ketosis in milk and urine. So acetoacetate reacts with nitroprusside to cause a color change in the white to purple. So when you add or so the greater amount of ketone, the darker the purple color and higher the degree of ketosis. So this is nothing but the test. Milk and urine ketone test are quick because and easy cow side test. However, sensitivity and specificity are most important measurement to determine the quality of the cow side ketone body test because we get the milk and your uh, urine very easily. So in general, in ketosis, we get a very sweet odor from the milk of your from your nasal secretions. All these things, but in subclinical ketosis, we might not get these types of symptoms. So we have to test for the ketone bodies. So monitor the milk fat proportion to protein ratio. So increases in the percentage of the milk fat in milk cause there is negative energy balance. So obviously there is increased level of the fat in the milk because as there is breakdown of your body fat. So obviously this will reflect in your milk. Second, coming to protein in milk will fall significantly. As you know, if milk fat concentration rises, obviously the protein concentration declines because protein is nothing but the building block of the animal. So if protein concentration becomes decline, the animal will be definitely it will more be thin and emaciated. So if a cow have a fat to protein ratio greater than or equal to 1.5, a true protein system. So this herd may be an electrolyte of clinical ketosis. If this concentration rises, then generally 1 is to 5, and this is 3 to 5 or 4 is to 5, then we are easily are certain the incidence of your subclinical ketosis. So clinical pathology, what are the clinical manifestations? The your blood glucose parameters. So normal 50 mg per ml. In subclinical ketosis, as you told, it is hypoglycemic conditions, that is 35 mg per deciliter, and very clinical cases in it is 20 mg, like in plain ketosis. In subclinical, it in between the normal and the clinical one. As you know, the beta hydroxybutyrate in blood, in normal cases it is 1000 millimole, sorry, micromole per liter. In subclinical ketosis it is 1400, and in clinical cases it is more than 12500 micromole per liter. So BHBA means beta hydroxybutyrate is used in serum and plasma as it's stable than other ketone bodies. So we are going to quantify this compound. So protocol for monitoring subclinical ketosis. So cows should be monitored every day during the first 2 weeks of calving, because the first 2 weeks are very important periods in which the animal going to exhibit this disease. So during the first 2 to 3 weeks after calving, ketone levels increase very sharply, will become very steady and decrease as dry matter intake increases and more favorable energy balance is achieved. So, so feeding on the propylene glycol, this compound accelerates your gluconeogenesis process, and it should be given 350 to 1000 ml for animal just prior 9 days before the calving. So this compound also maintains the positive energy balance and avoids the negative energy balance. So drenching of the glycerol and propionic acids and its salts has been proven beneficial in many field trials. So, before your parturition, you should administer one propylene glycol to the animal, so that in after parturition, the incidence of your subclinical ketosis or either ketosis will be less or will be negligible. So the control is very important in every diseases. So it can be done by biochemical monitoring of blood glucose levels less than 35 mg per deciliter at 2 weeks of lactation. So this is most important, because in ruminants, as you know, the 40 mg to 50 mg per deciliter of your glucose is the standard, and if it goes beyond or goes less than 40 mg per deciliter, then this is a cases of negative energy balance or might be suspected for subclinical ketosis. So urine and milk samples should be collected 14 days of the post calving. So I have collected all this data and information from the blood book, the Amalan Chakravarti, the Intersfolvet, and the journal. So hope you have enjoyed this video, and if you have any queries or any and you have to, and if you want to insert some any clinical features or any very good points to my slide, then please give your valuable suggestion in my comment box, so that I can improve my technical efficiency in the next slides. So hope you have enjoyed this video, and finally do and subscribe to my channel, so that do subscribe as well share to my channel. Thank you.